you're wondering, is LASIK really for you? I'm with Dr. Petlin at Nationwide Vision Centers, and he is going to dispel the myths around LASIK surgery. And who knew? There are a lot of them, Dr. Petlin. First of all, thanks for having us here.
Thanks for having me.
Okay, let's talk about who's a good candidate. Let's dispel myth number one. People think that if you have astigmatism, you can't, or you're not a good candidate for LASIK. Is that true?
That's true. Yeah, amazingly, we still hear that, even though technically that was something that was dispelled about 20 years ago. But we still have patients come in frequently thinking that their astigmatism is a hang-up and thinking that it's a reason that they can't have successful surgery, but that's been not the case for a long time.
That's not the case anymore.
No,
so you can help those people.
Exactly.
All right, let's talk about age. A lot of people think, oh, LASIK is just for older people. Is that true?
No, in fact, it really, if you think about the investment in getting your vision fixed, and if you think about the return long term in terms of being out of contact lenses and not having to wear prescription eyewear, we really think of the sweet spot for LASIK as being patients in their mid-20s and late 20s and early 30s. Even patients who oftentimes don't think of their problem as being particularly severe, especially those patients really, because the reality of what we do is that the smaller the prescription, the better the procedure. And there's a lot of patients that imagine that LASIK really isn't something that they should be thinking of because they don't imagine their problem as being particularly bad. Or they may only wear glasses occasionally, or only when they're driving, and occasionally wear contacts, and really don't think of LASIK as having a place for them. But those are actually our most kind of cherished patients, really.
Well, let's talk about the cost then, because if you think about it, a lot of people think, oh, the technology, it's over the top, I just simply can't afford it. But I like the comparison that you do, especially for millennial-aged clients and customers. By the time you spend money on contacts and glasses, you can easily afford a LASIK procedure?
Yeah, it adds up quicker than you might think. I think the studies suggest that the average contact lens wearer spends about $350 to $400 a year on contacts. And so, with the average price of LASIK, it really doesn't take more than 5 or 6 years to get that return back, and that'll be ahead from that point forward. So, yeah, it doesn't take much to get that back.
Let's talk about technology, because I know that the technology continues to evolve, but you've been bladeless. LASIK surgery's been bladeless for some time now, because I would think, and I've never considered LASIK, but the blade thing does kind of scare me. But you don't use them anymore. Right,
and that's been true now for a decade too. I mean, it is true that LASIK has been good for a really long time, and there are patients out there that are imagining that we keep making these big jumps, and we really don't. It kind of reached a feverish pace and then has really kind of steadied. The biggest thing that's really helped us has been, like you mentioned, the ability to do LASIK without doing any cutting, not using a blade. That's this laser right here. But the technology that we use these days is just incredibly good and safe.
And not to mention, it's like 20 seconds per eye, which is crazy. That's crazy. Yeah. Okay, one last myth you'd have to dispel, that if you have LASIK at a younger age, you have to do a do-over later. Is that true?
That's typically not true. And we get that a lot too. Patients worried that, hey, if I get my vision fixed for distance at 25 or 28 years old, I'm going to be back in here 4 years or 6 years later, and I'm going to have a distance vision problem again. And that's really not common at all. People will naturally lose their near vision as they get into their early to mid 40s, but actually once someone has LASIK and their distance vision is truly fixed for distance, we imagine them as being not that much different than someone who was born with good distance vision.
All right.
Which usually their distance vision doesn't change over time. So.
Wow, good information. Yeah. Thanks for clearing
You're
that
welcome.
up,
Thanks.
Dr. Petlin. All right.
Thanks for being here.
No, thank you, because if you want more information about LASIK surgery, here's where you go. Well, in Nationwide Vision Center, they have a special offer for you. If you call now and book your surgery, they'll give you $1,200 off. And to find out where you can find a Nationwide Vision Center near you, call 1-800-I-CARE or visit nationwidevision.com.